Welcome to your daily dose of enlightenment. You've landed on Knowledge Planet, where curiosity thrives and the enigmatic is revealed. Daily, we delve into a variety of topics, shedding light on the hidden and sharing insights to amaze you. Consider us more than just a channel. We're a growing community, a family of knowledge seekers. We're on a mission to reach global corners, inviting you to join our exploratory. We need you, our growing family. In red, subscribe. Become part of our community. Share your thoughts, interact with us. A like or even dislike all count. Don't forget to stay updated. Ring our notification bell. Stay tuned, stay curious, and together we'll continue to explore the vast expanse of Knowledge Planet. In the coming years, antibiotics might not work anymore. Yes, folks, some antibiotics could become literally useless. And unfortunately, it's estimated that about 10 million deaths per year could occur by 2050 because of this. Why? Well, some bacteria in nature are already resistant, and they're becoming even more resistant to antibiotics. Consequently, bacterial infections like pneumonia, tonsillitis, or cystitis could become increasingly difficult to treat. I know it may sound like we're trying to instill psychological terror, but it's crucial to address this incredibly important issue now, because together we can limit the damage in the future. We're talking about antibiotic resistance, which is currently considered by the World Health Organization as a serious threat to the entire world. So today, let's dive into what antibiotic resistance is from a scientific standpoint, what causes it, and what we can do now to minimize future harm. Because yes, there are things we can do and things we shouldn't do to fully understand what this phenomenon of antibiotic resistance is. Let's start by understanding what an antibiotic is. We all know the word antibiotic and immediately associate it with medicine. But not everyone knows what antibiotics really are, why they're prescribed, and not knowing the answer is actually one of the problems that has led to antibiotic resistance. So let's delve a little deeper. Antibiotics are substances that can fight bacteria, not viruses, fungi, or other microorganisms, just bacteria. They work by either preventing bacterial growth or outright killing them. Now you might be wondering, what exactly are bacteria? Bacteria are tiny living organisms found almost everywhere: your skin, your intestines, your mouth, virtually every nook and cranny of your body. Not all bacteria are harmful, though. There are good bacteria and bad bacteria. Good bacteria, for example, on our skin, help protect us from external microorganisms. Those in our intestines are vital for digestion and overall body function. But then there are the bad ones, the bacteria that can cause illnesses if they infect us. In the next scene, we'll be exploring more about how bacteria become resistant to antibiotics and why this poses such a significant threat to global health. Stay tuned. In our journey to understand antibiotics and their resistance, it's crucial to note a significant aspect. Antibiotics are often not selective. This means they don't discriminate between good and bad bacteria. They're designed to kill bacteria, period. So when you take antibiotics, they are wiping out the harmful bacteria causing your illness. But unfortunately, they're also taking down the beneficial bacteria in your body. You see, when you're prescribed a course of antibiotics, you might notice that your doctor often recommends taking probiotics as well. Ever wondered why? Well, probiotics are essentially good bacteria that need to be reintroduced into our bodies because the antibiotic has wiped out both good and bad bacteria. They help restore the balance in your gut microbiome, aiding digestion and maintaining your overall health. Now, before we move on to the more serious matter of antibiotic resistance, let's take a moment to appreciate the work that goes into making these videos. If you enjoy our content and want to support our mission of disseminating scientific knowledge, consider subscribing to our channel. Just click next to our logo, hit subscribe, and you'll be contributing immensely to our cause. We greatly appreciate your support, and now let's delve deeper into the world of antibiotics and resistance. Let's now delve into an important discussion. When should we use antibiotics, and when should we not? It's a common misconception that antibiotics can cure all types of illnesses. We tend to reach for that leftover antibiotic in our medicine drawer whenever we have a cold, a sore throat, or a cough. But this is a practice we need to stop immediately. Remember, Antibiotics are effective against bacterial infections, not viral ones. The National Institute of Health confirms this. Antibiotics can't battle viruses that cause conditions like the common cold, flu, or even most sore throats. So it's essential to consult your trusted doctor before popping an antibiotic pill. They're the ones who can confirm whether your illness is bacterial or viral. Using antibiotics when not needed not only wipes out your body's good bacteria, but it also makes you more susceptible to harmful ones. Ever thought of questioning your doctor when they prescribe antibiotics for conditions like flu or cold? It's okay to do so. Politely ask, "Excuse me, is the antibiotic really necessary? Are we sure it's a bacterial infection?" Remember, there's no harm in being sure. And what about those leftover antibiotics? Never use them without consulting your doctor, even if you think you're dealing with the same bacterial infection as before. Also, never take antibiotics preventively, thinking, "I'll take some before winter so I don't get sick." Following your doctor's instructions is crucial, not just for your health, but also to combat the growing problem of antibiotic resistance. In the next scene, we'll explore the serious issue of antibiotic resistance. But for now, let's pause and think. Are we using antibiotics responsibly? In our previous discussion, we talked about the correct use of antibiotics. Now, let's dive into a more serious issue. What happens when antibiotics are misused or overused? When we don't use antibiotics correctly, we risk the emergence of antibiotic-resistant bacteria. This means these bacteria have evolved to survive the antibiotics designed to kill them. Imagine this scenario. You contract pneumonia caused by the bacterium Streptococcus. You start to feel unwell, suffering from a high fever, cough with phlegm, and chest pain. Your doctor prescribes you amoxicillin, a common antibiotic. But after following the instructions and completing the course, your symptoms worsen. The Streptococcus bacterium infecting you has become resistant to the amoxicillin. Now your doctor has to prescribe a stronger antibiotic, which might be more expensive and have more severe side effects. You start the second treatment, but the disease continues its course. If the bacterium is resistant to the second antibiotic as well, the disease could escalate, potentially leading to a fatal outcome, especially in older patients. This is the terrifying reality of antibiotic resistance, bacteria evolving to resist all existing antibiotics, leaving us without an effective therapy. This could take us back to the pre-antibiotic era of the 1800s, when surgeries, organ transplants, cancer chemotherapy, and other medical procedures were impossible due to the risk of infection. The World Health Organization warns that antibiotic resistance is one of the biggest threats to global health today. It could cause tens of millions of deaths each year. As alarming as this sounds, discussing it is the first step in fighting this phenomenon. In the next scene, we'll explore how we can contribute to preventing antibiotic resistance. But for now, let's reflect on the magnitude of the problem. Are we ready to take action? As we continue our exploration of antibiotic resistance, let's now turn our attention to the solutions. How are we as a society responding to this threat? And what can we, as individuals, do to help? First and foremost, awareness of the problem is already a major step towards limiting future damage. By discussing antibiotic resistance and sharing this knowledge, we are actively contributing to a more informed and cautious society. Always remember to follow your doctor's instructions when prescribed antibiotics. On a more personal level, we can help reduce the spread of bacteria and thus the inappropriate use of antibiotics by maintaining good hygiene and protecting others when we're ill. This could mean using masks, washing our hands regularly, and being careful not to touch our faces. At an institutional level, efforts to combat antibiotic resistance are ongoing across the globe. As of now, 178 countries have developed national action plans against antimicrobial resistance. For instance, Italy has approved the National Plan to Combat Antibiotic Resistance for 2022-25. This plan focuses on training, information dissemination, research, and cooperation among national and international experts, with a primary goal of prevention. Moreover, research is being conducted to discover new drugs, including antibiotics capable of combating the most resistant bacteria. Even artificial intelligence is being employed in this fight, making significant strides in recent years. So you see, while antibiotic resistance is a daunting challenge, it is not an insurmountable one. By working together, both on a personal and institutional level, we can help turn the tide against this global health threat. In the next scene, we'll delve deeper into the role of artificial intelligence in combating antibiotic resistance. Stay tuned. As we've spent a good deal of time discussing antibiotic resistance, it's crucial to note that this issue extends beyond just bacteria. The term antimicrobial resistance encapsulates the broader problem, including resistance found in viruses and fungi. In a similar vein to antibiotic misuse in medical scenarios, antimicrobials are often misused in agricultural settings, such as farms, leading to increased resistance. This misuse can occur when farmers use these drugs to promote growth or prevent disease in healthy animals, rather than treating sick ones. Such practices can create environments in which resistant microbes flourish and spread to humans through food, water, and the environment. Regulating the use of antimicrobials in such settings is thus a crucial part of the fight against resistance. By implementing stringent rules and guidelines, we can help curb the overuse and misuse of these drugs, thereby slowing the spread of resistance. So while we've focused on antibiotic resistance today, remember that the challenge is much broader. Antimicrobial resistance is a complex, multifaceted issue that requires our attention on all fronts, from the antibiotics we take to the food we consume. In the next scene, we'll wrap up our discussion with some final thoughts and important takeaways. Stay tuned. As we delve deeper into the issue of antimicrobial resistance, it's important to understand its economic repercussions. The World Bank estimates that antimicrobial resistance could entail additional health costs of about $1 trillion by 2050. To put it in perspective, $1 trillion is a massive sum, and the potential gross domestic product, GDP, losses range between $1 trillion and $3.4 trillion per year by 2030. This isn't just a health crisis, it's an economic one too. The ramifications of this issue could be devastating, impacting our economies and societies in ways we can't fully predict. But there is hope. Here at Knowledge Planet, we believe that knowledge is power. By raising awareness and educating ourselves about this issue, we can make a difference, no matter how small it seems. We care deeply about this problem and are dedicated to helping prevent it. Each one of us, as part of the Knowledge Planet community, can contribute to this cause. Your contribution could be as simple as using antibiotics responsibly or spreading awareness about this issue among your friends and family. Thank you so much for joining us in this crucial conversation. We look forward to continuing this journey with you here on Knowledge Planet, where the power of knowledge can help us create a healthier, safer world. Stay tuned for our final thoughts and important takeaways in the next scene. Until then, remember, knowledge is power, and together, we can make a difference. In this whirlwind of a world, staying connected has never been more important. Here at Knowledge Planet, you've found more than just a channel. You've found a place of engaging content, community, and shared experiences. Think about it. When you subscribe, you're not just joining a channel, you're joining a family that grows with every click, every share, every comment. So, don't be a stranger. Dive into the conversation. Add your voice to the mix. Agree, disagree, all perspectives are welcome here. And remember, sharing is caring. Pass along our videos to friends who could use a moment of insight, a laugh, or just a break from the everyday. Oh, and one more thing. That little bell icon? It's your ticket to never missing a beat. Click it and you'll be the first to know when fresh content hits the airwaves. So subscribe, comment, share, like, or even dislike, and ring that bell. Here's to growing our Knowledge Planet family, one video at a time. Stay tuned for our concluding thoughts in the next scene. Until then, remember, knowledge is power, and together we can make a difference. Goodbye for now, but not for long.